to the Healthy Joints, Healthy Lifestyle show. For those who don't know me, I'm Dr. Dada. I'm a rheumatologist for over 20 years. And today I have a dear friend, Dr. Julia Buchfuhrer. And this is, I think, your third time on the show.
Yes, it is. Happy to
Yes,
be
it is.
back.
Well, welcome again. So, Dr. Julia Buchfuhrer is the founder of JB Arthritis and Rheumatology, and she's in Los Angeles. So, if you have a rheumatology condition and you're in the LA area, I cannot recommend anyone better than my dear friend, Dr. Julia Buchfuhrer. So, Dr. Julia, I think we've talked about why you do what you do, but tell us again, why do you do what you do?
You know, I played a lot of sports growing up, and the big sport that I played in college was Division I rugby. And when you play rugby, you get hurt, and so I dealt with sprained ankles, wrists, you name it, and these things would be debilitating. And I just want my joints to feel better, so that not only I could be out of pain, but I could do things again. And so naturally, when I became a doctor, I said, how can I help people with their joint pain so that they can do things again? And here we are.
Here we are. Here we are. You are an amazing rheumatologist, and I always love your spin on things. I remember when we had that session where we were talking about like things that you could eat at Thanksgiving, and
Oh
we're
yeah.
talking about alcohol, and you were talking about a little spritzer with gin. And I
Yep,
thought,
yep.
I thought that is so innovative, right? I thought, oh, you know what? She's so, yeah. So I'm excited about our talk today. Today, we are going to talk about something called intercritical gout. Sounds terrible, but the gist is like, so people with gout, as we know, is due to high uric acid levels in the blood. Uric acid forms crystals, gets into joints, and when uric acid gets into the joint, people have these attacks. And so I'm going to let Dr. Julia Buchfuhrer, and because I think everybody knows what I think about it, but let's have Julia Buchfuhrer tell us basically, can someone with gout still experience inflammation kind of in between the attacks?
Yeah, this is something that I know you do this as well, as we spend a lot of time educating on gout, and we're not just educating on, okay, there's pain and there's inflammation when you have pain. We're educating on gout as a systemic disease. And there was a recent study that showed in these intercritical periods, which means between the gout flare-ups, between the pain, is there's inflammation in the blood. And if there's inflammation in the blood, it's not just sitting there. We know it can be causing damage.
Yeah, yeah, yeah. And you hear it all the time, though. You hear people say, I used to have gout.
Mhm.
My last attack was like 3 months ago. I have started drinking more cherry juice and my gout is gone. And then they're like, oh, I don't know what happened. All of a sudden, I had this attack. And, and what they don't understand is that the gout hasn't left. Right.
Absolutely. I call some of these patients ER jumpers because they, jump into the
Oh,
ER
you know what?
every time they have an attack, right? And it's not that the gout has been gone, just like you said. It's the gout has been sitting there. It's been at a low level this whole time, and then boom, we get a flare up, and there's a lot of pain, and we're limping, and it hurts, and that's when we seek care. But really, we should be seeking care the entire time to get the gout out of the body, get the junk, the uric acid junk out of the body to clear it from the system.
Yeah. And is it possible, that during that, so it's one thing for us to say there's inflammation during that quiet time rather, during that intercritical time, but do you think that uric acid is still accumulating silently, or what do you think could be happening?
Yeah, as long as that uric acid is above 6 or above 6.8 specifically, uric acid is accumulating. And what I tell patients is it's not just going to the joints. It is accumulating in any tissue it wants to, and a common one being the kidneys. So again, going back to the intercritical gout, the recent study that showed there's low levels of inflammation in the blood between gout flare-ups, if it's in the blood is everywhere in the body, right? The blood's going to the heart, the blood's going to the lungs, blood's going to the brain, kidneys, etc. So you have inflammation in your entire body, and it's affecting the whole body. And same thing with the uric acid, is it's constantly building. And I've seen it many times where we treat these patients, and the ones that are compliant and the ones that we get all the uric acid out of the body, I watch as that kidney function gets better and better and better. And I'm positive you've seen that as well.
Yeah, yeah, yeah. You look for evidence for that, and we don't have a lot of evidence, but it's something that you see clinically in our patients. That
Mhm.
yes, and I honestly agree with you that sometimes when you can get that, the uric acid crystals out of the tubules, that renal function actually does improve.
Absolutely. Absolutely. I mean, I've, like you said, there's no study proving this, but I've seen it enough times that absolutely this
We
is,
know it's true. We
yeah,
know it's
yeah.
true. That's true. Um, What is there anything else that we kind of maybe haven't spoken about, kind of in what the research says about the intercritical period? We talked about the fact that it's systemic, it's not just your joints, there is ongoing inflammation. Inflammation is not your friend.
Yeah, no, great question. So, not only can the crystals build up in the body, but that inflammation, again, in the blood, pumping through the body, going to every organ, every tissue, that causes damage. So things that have been associated with gout is cardiovascular disease, heart attacks, strokes, diabetes, high blood pressure, kidney disease. I mean, you name it. And that's from the inflammation as well as the uric acid crystals themselves. So when I'm treating a gout patient, the first thing I do is I educate them. And I tell them, hey, I know you're worried about your joints. I am too, but I'm worried about your entire health, because if we don't get this controlled, you could have a heart attack or a stroke, or, really anything could happen to your body because of this inflammation.
I think that is something that maybe it's not really clear to people, is
Mhm.
that, the high uric acid and the inflammation is a cardiac risk factor,
Mhm.
right? And that's something
Absolutely.
that it's not clear that people really understand. I
Absolutely.
think the focus is all on the joint because of the pain, but the silent part of it, is I think that information is really not getting to people, or
Yeah.
not
And
touching them. Yeah.
I think a lot of patients will say, hey, why are you scaring me? And I say,
Oh.
I'm not scaring you. I'm telling you what's
Mm-mm.
actually happening in your
Mm-hmm.
body. And,
Yeah.
you make a decision from there, but I need to
Yeah.
educate you, right?
Yeah.
I think
Yeah.
90% of our job is education and
Yes.
10% is prescribing the medication,
Yeah,
right?
yeah, yeah, totally agree. Yeah, and you do hear different versions of why you scaring me. You hear things like, I don't know if I just don't want to talk about medicines. I'm like, well, let's talk about it.
Mhm.
Let's talk about lifestyle changes. Let's be able to measure and say, okay, I want to try diet. And I'm like, that's excellent. Let's try diet, but let's measure, right? Let's measure
Yeah,
your uric acid. You want to lose some weight. Let's lose the weight. Let's measure, right? So
absolutely.
we know that we're
Absolutely.
moving towards a certain goalpost. And if we're moving towards it, fantastic. If we're not, we need to kind of make sure that we're armed with the information to make the right decision.
Absolutely. I think we have to meet people where they're at. And although I'm not the biggest proponent of the gout diet necessarily, I think you have to have a pretty low uric acid, maybe 7.5, to really be able to control your gout on diet alone. But I think if somebody really wants to give it a try, I agree. We just have to be objective, measure that uric acid level, and if it works, fantastic. I'll be
Yeah.
the first to say, great, this is absolutely great, keep on this. But as you know, more often than not, it's the numbers just don't add up and we don't
Yeah.
get there.
Yeah. And that's, something else that, maybe worth kind of mentioning a little bit. People do think, the old stigma, it's your diet, stop eating this, stop eating that. And we know so much more about gout, for instance, genetics.
Absolutely. So every time a patient starts talking about, everyone said it's what I eat, what I drink. I said the three top reasons people have gout are genetics, 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 right? And so I really tried to push that at my patients, at actually other rheumatologists when I'm talking to them. is we need to stop playing the blame game. This is not
Yes.
the patient's fault. And furthermore, we're probably not going to get it controlled if we even have the perfect gout diet, right? So we need to feel less guilty and accept the help with the medication.
Yeah, yeah, totally agree. Because I think the clinical trials showed that 10% is what you get with the strictest of diet. So if your uric acid is 10 and you're still at 9.9,
Yeah.
yeah, even with
Yeah.
the strictest, right? You haven't really made
Yeah.
significant
I mean,
improvement because you're trying to
absolutely.
get less than 6.
Absolutely. I think unless you were to lose a large amount of weight, about
Yeah.
50 plus pounds, I've
Yes.
seen people drop uric acid a lot, but that is keeping it off is a tough thing, and it's very hard to lose that kind of weight.
Yeah. 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 You're right. I think the one person that I have had, you have to have a weight to lose
Right.
too, right?
Right.
Yeah. Yeah.
Absolutely.
So one person I did have was, was significantly, had a very high BMI. And so he was able to lose the weight to a point where he was almost a new person. He was half of his previous self. In that
Wow. Wow.
situation, then yes, all that would work. And we were still on the medicines until
Mhm.
the measure, and they were like, oh wow, your uric acid is like, 4. I'm like, okay, no attacks, your weight's half of what it was. Let's see what life looks like without it. And he's done great. But
That's amazing.
that's not often the story, because a lot of people with gout, they're not that overweight. So 5, 10 pounds is not really gonna move the needle.
Exactly. Not going to move the needle at all. That was a perfect way to put it. So I agree wholeheartedly.
Yeah. So since we're talking about gout attacks, pain, and all that, can you share kind of a helpful tip for managing? I'm sure there's somebody with acute gout listening to us right now. Any helpful tip that you may have for a person dealing with acute gout right now?
Yeah, I mean, I'm gonna give my boring old, get a good rheumatologist. I can't stress it enough. Your gout does not need to be anything that you ever have to deal with again once you're controlled. And so many of my patients say, why didn't I come to you 20 years ago? And, I'm 36, so I tell them, well, I was 16 20 years ago, so you couldn't have come to me. But all jokes aside, gout is the only arthritis that we can fully remove from the body, the only one. And so we can treat it. We can treat it to remission, which means absolutely no more gout flare ups, no matter what you were to eat or drink, if it's controlled and you're on medication. And so get in with a good rheumatologist, please, 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 as soon as you can. That is my best advice.
Okay, that's a very good tip. That's a very good tip. So my next question, which I think we both know the answer to, but just in case it's not clear, if a person is in that period where it's quiet and they've had a history of gout, eh, should they consider ongoing management even though they feel fine? I really just need to be direct. I think we've hinted at it, but I think we just need to be like clear.
Yeah, absolutely. So just because you haven't had a gout flare up recently doesn't mean your gout isn't wreaking havoc on your organs and your body, destroying your joints. It's just a matter of time before the next gout flare up. And you need to get, again, uric acid is junk in the body. You need to get the junk out. We need it completely out of the body, so that you are healthy and you have a life expectancy of that of somebody without gout.
Okay, okay. And then what are the risk factors would you say that puts you at an increased risk for gout? Because I can see somebody saying, well, it was just one time I had this attack in my toe. They don't really know for sure that I have gout. Are there certain risk factors that should make that person say,
Yeah, I would say anybody who's possibly had a gout flare up should be checked out. I am a personal believer that one gout flare up, we know it's there. Why if somebody had one heart attack, why are we going to wait for the second heart attack, right?
Definitely.
Um, but risk factors, of course, with almost everything on medicine, obesity is obviously a big risk factor. And probably the biggest risk factor, aside from, again, genetics being number one, actually number 1, 2, and 3 genetics, but I'd say number 4 would be kidney disease. So
Yes.
we clear our uric acid out of our body through our kidneys. And when our kidneys are not functioning at 100%, we clear even less of it out of our body and more builds up. So if you were told, hey, your kidneys are functioning a little bit low, you've had a gout attack, I mean, no brainer to go get treated because
Yeah.
you're just building more and more uric acid in the body.
Yeah, totally makes sense. Okay. Can you tell us about a patient? Because we were talking about a couple of patients just before we started. Can you tell us about a patient that's been in your care, has had gout, and had a great outcome?
Yeah, I could name probably 50, 100 by now, but one patient, and I'll obviously not mention too many details here, but he came to me and he was completely disabled. He could hardly walk at all. He could hardly do any of the things he loved. And we ended up putting him on pegloticase or Krystexxa. And after 6 months, he said, I'm sick of these infusions. I don't want to do them anymore. It's every 2 weeks. And he brought his wife in, and I said, give me 6 more months, and I promise you won't feel this way. And his wife basically told him, you're doing 6 more months because doctor said.
Wives are great for that.
Yeah, wives are great for that, exactly. So, he didn't want to, but begrudgingly, he continued. And then 6 months later, I got a very long email from him. He said, I live in Los Angeles. It's about a 4-hour drive to Las Vegas. He drove to Las Vegas frequently for work. And he drove to Las Vegas this time, and he got out of the car and he went to grab his cane because anytime he had that 4-hour drive, he was kind of stiff and couldn't move. He went to grab his cane and he realized, I don't need this darn cane. And he threw out the cane. He threw out the cane. He said, I don't need this cane. And normally in Las Vegas, he would just go straight to his hotel room or the conference and not really walk a lot. That day, he walked 3 miles up and down Las Vegas Boulevard. He had a blast, and he said, I really gave him his life back. And obviously I put it back on him. I said, you did for a year, every 2 weeks of this
Every 2 weeks.
infusion.
Yeah, that's a commitment. So good
Yeah.
for him. Good for him.
He did the work. I was just there to tell his wife to tell him that he needs to keep doing the work. But he was one of my first Krystexxa patients, and I'll never forget that email. The day I got the email, it's it's life-changing. It's life-changing.
It is. And so it's funny, sometimes these things sneak up on you that you don't even realize it. He put the cane in his car when he left LA, and by the time he got to Vegas and he got out of the car, he's like, oh, wait a minute, nothing's wrong here.
Absolutely. Absolutely.
I love that.
Sometimes you don't realize how much better you're getting until
you don't. It kind of sneaks up on you, right? Until you ask, that's what I thought, you would like, until you ask specific questions. Oh, you're like, oh, well, this time last year, what were you doing? Like, oh yeah. Then it dawns. Then it dawns on them the difference. That's all. I love that story. So, my final question is, if you had a superpower, what would it be, and how would it help gout patients?
That's a great question. I think I used to think about this a lot more as a kid, as far as the superpower, not the gout patients part, but I've always wanted the power to see the future, to know the future. And I think if I'm talking about my gout patients, I would be able to identify the ones that aren't coming back until they have a flare up, right? Because no matter what medicine we use, we say, hey, you're all better, but you need this medicine for life. So don't ever get off this medicine. And then 95% of patients listen, and the 5% will come back. They always come back, and it's 6 months, 12 months. And oh my gosh, I have a flare up. I went off the medicine. And they say, please don't tell me you told me so, right? So I would use that superpower to kind of, okay, which are these 5% of patients that are going to go off the med? And I'd give them a call before they got their next attack and get them back in.
Because with each attacks come additional damage, right? So it's not just the pain and swelling, it's, how do we preserve joints? Because as rheumatologists, that's our job. We want to keep everybody with healthy joints and healthy lives.
Absolutely. I couldn't have said it better myself.
Yeah. Well, Dr. Julia Buchfuhrer, thank you so much for taking the time today at the end of a long day seeing patients and just sharing your words of wisdom. So, if anybody wants to work with you, how do they find you?
Absolutely. So we are in Downey, California, which is part of Los Angeles County. If you go to jbarthritis.com, you can find us, all of our information there. Our phone number, just give us a call.
Okay, fantastic. So we're going to have your information, website, Instagram, YouTube, at the bottom of this video. Thank you everybody for watching. So if you know anybody with gout, make sure you send this to them. Share this video, like it, subscribe to our channel, and we'll see you next time for more important tips on how to make sure that you live a healthy joints and healthy life. Thank you, Dr. Buchfuhrer.
Thank you. You have a good one.